Hello, PsychU community, and welcome to today's webinar. Where is this all going? What are states doing or not doing to address our mental health crisis? Trends in behavioral health, financing models, and state innovation. Thank you for joining us today. I am Heathen Patadia, a managed market liaison for Otsuka Pharmaceutical Development and Commercialization. I'll be serving as the moderator and presenters for today's exciting discussion featuring Richard Lewis III and Deb Adler. Today's presentation is sponsored by Otsuka Pharmaceutical Development and Commercialization, Inc. and Lundbeck, LLC. Committed supporters of the mental health treatment community, speakers are paid consultants to OPDC. So let's take a moment today to review our objectives. We will go over the status of mental health in the United States, check in on the healthcare coverage by state and mental health system rankings, discuss how states are rising to meet the mental health challenges, and review Medicaid expansion status across the United States.
Thank you, Hayden. We're going to start off talking about the overall state of mental health in the United States. And certainly the year of COVID-19, 2020, has had a tremendous impact on the state of mental health in the United States. Let's start with the provider community. Many provider organizations, behavioral health focused, and those also focused on individuals with intellectual and developmental disabilities, IDD, have had impacts in terms of revenue. For example, the National Association of Addiction Professionals did a study recently and found that many organizations were seeing lower revenue. In the IDD space, there was significant impact and closing of many service lines as a result of some of the government mandates associated with COVID-19. You might say there have been some winners and losers, so to speak. Many of the digital therapy organizations actually saw enhanced revenues throughout the COVID era, and those organizations that quickly pivoted to telehealth delivered services were able to better sustain the challenges that COVID brought into the environment. That said, there has been a tremendous amount of private equity put into this space. In fact, the first half of 2021 has already broken the record in private equity funding in behavioral health compared to the entire year in 2020. If we could just back up to the previous slide, I do want to mention as well the impact on the workforce shortage. Prior to COVID, there was a well-known challenge of the national shortage of psychiatric providers. And so the availability for prescriptive capacity was really challenged. Once COVID hit and the demand really grew, we saw, I think for the first time, master's level counselors and peers were very much in short supply. And that has had a huge impact on the cost of recruiting providers that are in at that level of care, that type of provider. We've also seen virtual delivery and telehealth on the rise year over year, with COVID really accelerating the growth of telehealth, and Richard will share some of those stats in a little bit. And then we've seen continued focus on medical behavioral integration and programs that focus on whole person care, integrating both the behavioral health services with primary care services. To punctuate that, we'll go a couple of slides in to talk a little bit more about the workforce shortage. I was not surprised to see the shortage of psychiatrists and mental health professionals. As I mentioned earlier, a lot of competition from both telehealth companies and standard brick and mortar companies to recruit and acquire behavioral health practitioners and counselors. But I thought it was also very intriguing to see the heightened demand for peer support specialists. And by peer support specialists, I'm referring to individuals with lived experience who are able to provide supportive services, facilitative services for individuals with behavioral health needs. I guess the short version is, there's a much higher demand than supply available, and that becomes even more problematic and challenging as individuals being able to support individuals who may be from diverse cultural backgrounds as well.
Thanks, Deb. So, we certainly saw a huge pivot and expansion of telehealth services among the provider organizations nationally. And providers often had some semblance of telehealth. However, their own survival and sustainability during the pandemic forced them to have to find new ways, and telehealth was the easiest way to continue access and treatment for their members. One of the things that helped was the rules were relaxed during the pandemic to make it easier for individuals to find and pay for much needed mental health care. The U.S. Centers for Medicare and Medicaid has indicated that many of the telehealth expansions allowed during COVID will remain permanent. Many payers are, and we'll talk about that in a minute, many payers are signaling that telehealth is here to stay, that it's worked in many ways, not only in access, and we've seen no-show rates going down, being reported by provider organizations. Overall, the payer expectations, I think, have been positive with regard to the future of regulations for telehealth. And again, many of them indicating that, platform standards need to be modified a bit. I think we're going to start to see a little bit more in the area of hybrid models, where we're being able to use both telehealth and virtual consultation in conjunction with face-to-face treatment as usual. Again, I think in general, it's been the payer expectations remain positive about continuing forward with using telehealth, as well as paying for telehealth to providers with limited modification, other than on the move towards more hybrid type platforms. The future of telehealth expectations on this particular slide on a scale of a 5-point scale, where 1 is of not importance to the future of telehealth, and I'm sorry, 1 is of no importance and 5 is very important. We can see that for psychiatric inpatient bed availability, I think it is important for Medicare, as far as Medicare as a payer source, scoring high. Long-term care supports, I think telehealth has had a very positive impact in long-term care and supports in using telehealth to be able to provide services virtually to clients in the community, to continue to keep them in lower levels of care. Adequate services for individuals with autism, again, scoring very high in all payer categories: commercial, Medicaid, and Medicare. And I'll skip to just the access to addiction services, which we're seeing more and more of telehealth, even before the pandemic, coming into play in terms of the delivery of addiction treatment services in-home, virtually, with use of other technology for case management as a means of maintaining good clinical outcomes for the addiction treatment population.